couple weeks ago, my therapist that I've seen for over 3 years and that specializes in autism did like preliminary screening with me where they went over the DSM criteria, asked me questions, and then basically told me whether or not their opinion was that I met those criteria. They believe that I do. So I'm not formally diagnosed with autism as they are a therapist and cannot do that diagnosis, but they're somebody who knows me very well and who knows the criteria really well. They have additional training in autism. I thought that people might find it interesting to go over the details of this because I know a lot of people have commented things like that they find it confusing, like the difference between what is like actually autism versus what might kind of look like autism but is actually ADHD or CPTSD or anxiety. So I thought I would just go over what I shared with my therapist in that session. They did say something to the effect of, I have heard a lot from you over the last over 3 years, so I kind of have an idea of a lot of this already. So I don't know 100% if the answers I gave all qualified or if there were any of these criteria that maybe the exact answers I gave didn't quite qualify, but maybe I've said things before that they remembered that would qualify. I'll go through their criteria and share the things that I shared. So there is criteria A, which is 3 points related to socializing and interacting, and you have to have all 3 of those criteria to qualify. And so this is like the A section. There's A1, A2, and A3. A1 is reciprocity within social interactions. So some of the examples that they list that can qualify for abnormal reciprocity: having a failure of typical back and forth within a conversation. And I believe that that can be a failure of normal back and forth in a lot of different ways. Reduced sharing of interests, emotions, or affect, or failure to initiate or respond to social interactions. So what I shared for this part is that I realized a year or so ago that I don't ever bring up my interests in a conversation unless I know that that person shares that interest. Like, I kind of thought that's what you're kind of supposed to do. But I guess that is not typical, so that's reduced sharing. I think that a way that I don't do typical back and forth is, at least historically, I didn't ask people enough questions. Like, sometimes I do think of questions that I kind of would like to ask, but I think, like, I worry about being invasive a lot or like prying or being nosy. And so for most of my adult life, at least, I have erred on the side of not asking questions. But I saw something online a year or 2 ago that was like venting about how hard it is to hold conversations with people who don't really ask you questions, and just kind of, you have to keep the whole conversation going. And I realized, like, crap, like, I am that person who is making conversation hard for people because I'm not asking questions. So since then I've tried to ask more questions, but it's still kind of hard for me because I try to like ask safe questions that I think are very unlikely to be like prying or invasive, and it's hard for me to like think of questions that aren't nosy, I guess. Anyway, I think that is one way that I struggle with reciprocity. And like, I don't really remember anything about how I got to where I don't initiate conversations about my interests with most people, but I would assume that that probably came about because if I let myself talk about my interests, it is easy for me to monologue too much. I also mentioned in this criteria that I know that I feel like I do better in conversation with people who are really good at carrying the conversation. I have one sister who is great at conversation. She's like very outgoing. She can just hold a conversation with anybody and everybody, stranger, it doesn't matter. And so I like going to family events with her, or really any event with her, because she can initiate conversations and keep conversations going, and then I can like jump in periodically, and it's so much less stressful for me than trying to have a conversation with most other people who don't carry the conversation as much. And so I think that that is a sign that I over rely on other people to carry the conversation, which again is a sign of a lack of that back and forth reciprocity. Also, all of this criteria has to be present in childhood because this is a developmental disorder. I don't have really distinct memories of how these things showed up for me as a kid, unfortunately. But I know that I didn't have any sort of like major brain injury or anything that would like explain me struggling now if I would have had these skills as a kid. So I just assume this is how I've always been. I don't really remember in detail though. A2 is deficiencies in nonverbal communication behaviors. So this can be poorly integrated verbal and nonverbal communication. I have no clue what that means. I probably should Google that. But another example is abnormalities in eye contact or body language, or difficulties understanding or using gestures, or a lack of facial expression or nonverbal communication. This is the A criteria that I feel the weakest on, the criteria that I was least sure that I met. I definitely do less eye contact. I don't really think about my eye contact that much now that I'm thinking about it. I'm even like conscious of looking into the camera, so it's making it worse. Yeah, my husband mentioned like years ago that I don't make a like normal amount of eye contact, but this was when I was like going through a phase of like, could I be autistic? Because it's kind of a stereotypical autistic trait. But at the time I thought maybe it was anxiety or something, but I definitely don't have typical amounts of eye contact. I'm so conscious of it right now. It's so annoying. I don't have typical amounts of eye contact even when I am quite comfortable with people. I do always like glance at people, but I definitely look away more than I look at somebody's face. And on rare occasions where people have specifically tried to like kind of force eye contact with me, it is very physically uncomfortable. It makes my eyes feel like I need to sneeze, like kind of that like itchy feeling, and like the longer I do it, the worse it gets. So A2, I think my biggest one far and away is eye contact. I think I use pretty typical facial expressions. I think I understand other people's expressions and body language pretty well. I think that that's the only one that I mentioned to my therapist, so I assumed that one counted unless there is something about my facial expressions or my body language or nonverbal communication that they have witnessed in therapy that they were seeing as qualifying for that. A3 is deficits in developing, maintaining, and or understanding relationships. Some examples that the DSM lists can be struggling with adjusting behavior for the context. So like understanding the differences in appropriate behavior, maybe like at the library versus at a party, or at work versus at home, things like that. And of course, difficulty making or maintaining friendships. I don't feel like I struggle to understand the differences in appropriate behavior in different contexts. I feel like I do fine with that. But I definitely struggle with friendships in general. I have never been like a true loner. I have always had at least a friend. But my whole adult life, I really have only maintained online friends, and that has been through like finding friends in communities that kind of share an interest that I have. And so that kind of gives me like an in with them and something I know I can talk to them about. I've never, and like as a kid, I made friends in school, but they all really fell away after high school graduation, and I didn't make any friends in college. Like I was able to sit with people and kind of make small talk like during class, especially like art classes or things where there wasn't just like lecturing the whole time. Like I can interact with people, but like there was one girl in like some of my art classes that I actually quite enjoyed like sitting with and talking to in class. But like it never like went anywhere. Like I think that step from like routinely small talking with somebody to actually like slowly getting closer to somebody is a place where I really struggle. The friends that I have made, it's kind of been like they often kind of just click with me, and then they open up to me really deeply, really quickly, and I do the same, and then it's like we almost just kind of become instant best friends. There isn't that like kind of typical progression into phases of trusting each other. And it's always just kind of felt like a little bit mystical or magical to me when it happens that way. Like I can't make that happen. It I don't know. It just feels like chance to me when that has happened. I do have a little bit of a detail from childhood on this one. Always kind of felt like I was kind of lower in the hierarchy within a group all the time. Like I was kind of barely in any friend group that I was in. I did have some specific things come up with friends at least twice. I specifically recall like once in third grade and once maybe in like seventh grade, where friends got frustrated with me that I was wanting to like keep doing the same thing or keep talking about the same thing too much, and that caused problems. Another thing I can like specifically remember from childhood as far as friendship difficulties go is I remember if I would be somewhere like, I don't know, my mom's old like high school friend that I hadn't really been around these people very much, and there would be other kids there like around my age, or even just like at like a public park or something, or like my cousin's birthday and my cousin's friends were there or something. I remember like watching kids play and like wanting to play with them, and like even wanting to like become their friend, and just kind of sitting there and staring and like longing, and not knowing I could, or even considering how I might attempt to actually get to know them or play with them. I think I really would kind of wait on other kids to be willing to play with me and to like somehow be open to that, or to specifically invite me. Sorry, I intended to do this in one video, but I'm only through criteria A and this is already too long, so I'll do a part 2 going over the B criteria.